Hi, we're here today with Dr. Michelle Bache, Vice President of Medical Affairs with Elkhart General Hospital. Dr. Bache, I wanted to get your thoughts. Let's just start right away with the new mask order that was just enacted today, takes effect tomorrow in Elkhart County. Talk to me about your thoughts on this.
I feel it's a great move. I'm very happy to hear that Dr. Mertz has put that into place, and there is really wide support for that throughout, all of our cities. I know the mayor of Elkhart, the mayor of Goshen, they've been very supportive of this, and of course the hospitals as well. We feel that that is really the right move and the most effective thing that we can do to try to contain this coronavirus outbreak.
For sure. So talk to us about the current situation in Elkhart County. What are we seeing, Dr. Bache?
So the county, some glimmers of hope are beginning to show. I think the message has gotten out about our mitigation strategies and the mask wearing, how important that is. We're starting to see our percent of positive cases for the numbers that we're testing is coming down. Our total positives are also coming down slowly. We're still above the rest of the state in general as far as the number of cases we're reporting on a daily basis. But last week, end of last week, we started to see the percent of positive cases coming down around 11% or so. So really getting close to that 10%. If we could get below that and get below 5% even, that would really show that we are making headway in containing this virus.
Are we still third in the state county-wise, or where do we stand?
We are still third in the state county-wise. I think we'll probably hold that position because everybody else is focusing on the same things as well, trying to get their cases down. So I don't think we should dwell on that. We're probably going to stay number 3 for the foreseeable future. But the important thing is that the number of positive cases and the percent of positive cases to keep that trend line going down.
So what are we seeing at Elkhart General Hospital? Tell us about that.
So Elkhart General, we've talked before about how hospitalization, bench utilization, those are really lagging indicators about what's going on locally. So we are seeing the effects of the past 2 weeks of high case volume are really starting to show in the hospital. Last week was a pretty tough week. We were really, struggling to try to find, ways to take care of all the patients. We have a higher census today of COVID patients in the hospital than we have throughout the epidemic. But I don't want to be discouraged by that. Again, I feel like that is a lagging indicator. If we look at what's happening in the community, if we can get the cases to come down, we would expect our hospitalization rate also to come down. So we got a lot of help from the Indiana State Health Department. They were able to help us with some resources that we needed. Memorial Hospital was also very helpful. So we're trying to manage our surgical schedule and everything just to make sure that we have full capacity to take care of everybody that we need to.
Okay, I was going to say anything else besides, you mentioned Memorial helping, anyone else in the community that has been helping, and we are still reaching out to the community as well, right, in testing?
Yes, so we're testing widely, still trying to test in many different venues. There are many places that people can be tested without a doctor's order, without insurance, free testing. So I encourage anybody, you do not need to have symptoms, you do not need to have insurance. We are seeing, again, as we have talked many weeks, there is a very high percentage of people who are asymptomatic or pre-symptomatic with their infections. So if you don't have symptoms, it's still okay to get tested. If you've had exposure to somebody, a household contact, you absolutely should also be tested even if you don't have symptoms. And that's how we will be able to continue to control the spread of this virus.
What is your advice, best advice, heading into this holiday weekend? There will be a lot of people, I'm sure, just yearning and wanting to get together with others and probably being out there with others. So how can we keep ourselves safe?
Right. So, distance is important. So maintaining 6 feet whenever possible. whenever possible, given the option of being outside instead of inside is, really makes a big difference. There are very few examples of super spreader events that have occurred in outdoor settings. So I think if you want to get together with your family and have the barbecue, I think it's, probably reasonably safe to do that. Do it outdoors, wash your hands frequently, just using some common sense. I think that is important. And it's important for us to gather. It's important for us to be able to do these things to, maintain our mental health and maintain our relationships and our social connections. So, but there are safe ways to do this, safer ways than others. And I think, trying to be outdoors, which the 4th of July is just a great time to be outdoors anyway. So we'll hope for good weather and hope that people are able to follow those recommendations.
And again, to go full circle now, starting tomorrow, wear a mask out in public.
Wear a mask.
Dr. Bache, thanks so much, and glad to be ending this on a hopeful note moving
Yes,
forward.
agreed.
Okay, thanks so much, and we'll talk to you again soon.
Okay, sounds good.